Assalamu alaikum, my name is Dr. Saira Dar and welcome to our health show. We're talking about women's health issues and today's topic is breast health. Breast problems present as breast lumps, skin changes, nipple discharge, and whatever the symptom is, vast majority of breast problems are not due to cancer, and it's very important that we make that point right at the beginning. While getting the symptoms can be quite scary, it's important to speak to your GP or your nurse straight away and get that reassurance because, like I say, majority of the time it's not breast cancer that causes these symptoms. Today we'll be talking about breast lumps, we'll be talking about other breast symptoms, also the common breast problems and how they're treated, and a little bit about breast screening. So what do you do when you find a breast lump? Obviously it's very important, any new breast lump needs to be checked over and evaluated by your GP, so make an appointment and get that checked over. However, it's very difficult from examination alone to find out if the breast lump is cancerous or not. Majority of breast lumps in under 50 years old will not be cancer. However, when you do find a breast lump, what your GP does depends very much on how old you are. So for women that are under 30, breast lumps can usually be caused due to the hormonal changes that regulate your periods, and women find that maybe just before their period or some point through the cycle they may develop breast lumps. So your GP might want to evaluate and monitor that lump, and it's quite common for a GP to ask you to come back after 4 to 6 weeks to get that checked. If the lump is persistent, you will probably refer to the breast surgeons at this point, who may do an ultrasound or they may do a needle aspiration biopsy to see if the lump is fluid or solid. Mammograms in this age are not very common, they're not the first line investigation. In over 30s, again, in some cases the GP might monitor the lump, however it's more likely that you'll be referred to the breast surgeon, who will then at this point do an ultrasound with or without a mammogram. If your lump is fluid filled and they can check that with an ultrasound, usually this is not due to cancer and only needs treatment if it's causing pain because of pressure. If it is, then the fluid can be removed with a needle and that usually resolves matters. If it's a solid lump, that needs further investigation and often you'll need a biopsy done. A biopsy will be done at the breast clinic, usually at the time of your appointment, and they usually do that via a needle by taking some fluid out of the lump or maybe a tissue sample with a thicker needle. And that's to look at the cells that are making up the lump to get a better idea of what's caused the breast lump. Let's talk about breast pain and tenderness. Again, a very common symptom in women. Often it can be cyclic, which means it happens just before a period. If that's the case, the simple painkillers can help. Sometimes hormonal contraceptions can help with breast pain and tenderness. Again, seek help and do speak to your GP about it. If your breast pain or tenderness comes and goes and there's no kind of pattern to it, there's no cycle to it, again, do speak to your GP. It's very rare that this is due to cancer or anything concerning, and often it's treated with simple painkillers. Sometimes primrose oil or vitamin E supplements can help. There's not much evidence for these things, however, incidentally, people do find that they can improve their symptoms. Also, wearing a good fitted bra or a sports bra can help, so get yourself measured and make sure you're wearing something that fits right and is the right size for you, because that can make a massive difference. Often breast pain is due to chest wall, muscular or kind of rib pain, so all these kind of simple measures can make a difference. Some people advocate a change in diet, like decreasing high fat foods and also decreasing caffeine intake. Again, this can also help breast pain and tenderness. Let's talk about nipple discharge. Again, a very common symptom in some women, and if it's been up to 1 year, even actually up to 2 years post birth, women can get some milky discharge from both breasts, which happens spontaneously. Other causes of nipple discharge from both breasts that may cause a milky discharge is side effects of medication and sometimes hormonal disturbances. So if you see a GP and it's not related to having a baby, your GP will probably do some blood tests to find out what the cause of that discharge is. It can be normal to have some nipple discharge if you squeeze your breast, because you have ducts in your breast that carry some normal secretions. So when one squeeze, you can sometimes get a small amount of usually coloured discharge, not blood stained. It shouldn't be blood stained, and if that happens, that's called physiological discharge, and that's quite normal. It's a normal part of your physiology. However, if you have spontaneous discharge, and that's discharge that happens without squeezing your breast, and it's clear or blood stained, that needs investigated. See your GP immediately. You will be referred to the breast surgeons because that can be caused by some sort of breast growth and needs to be investigated further. Other symptoms to take note of are breast skin changes, especially skin changes around the nipple. Sometimes you can get an eczema, sometimes you can get inflammation or crusting. If that happens and it's persistent and it doesn't go away with simple creams, speak to your GP and that needs further investigation. Also nipple inversion. Now some women have natural nipple inversion and they've always had that, nothing to be worried about. However, if you develop nipple inversion and it's persistent, again seek advice about that because sometimes breast growths can cause nipple inversion and that needs investigated. The most common breast problems that women present with usually don't need any treatment, they just need evaluation, and once we know what the problem is, we just offer reassurance and can be left alone. The most common one is fibrocystic changes in the breast. Usually you find a lumpiness or some swelling in a breast, and that's very common in young women, usually above the age of 35, and it's hormonal related. Once that's been investigated, diagnosed, often can be just left alone. Cysts are also very common in young women, and 15% of all breast lumps will be cysts, and once the fluid has been removed from a cyst, if that resolves the problem, that doesn't need any further investigation unless the same cyst refills up again and again. Fibroadenomas, which are very small, quite leathery, firm nodules that are very mobile in the breast, are very common, especially in under 30-year-old women. And once diagnosed, they can be left alone because they're nothing to worry about. They don't need any further treatment. Sometimes women that are breastfeeding can get blocked milk ducts, and the skin can get, the area around can get quite inflamed, quite swollen. Sometimes you'll need antibiotics, but again, you have natural ducts in your breast, and once they get filled up and blocked, that can cause some infection, easily treated. Let's talk about something that worries all women: breast cancer. It is the most common cancer to affect women around the world. 1 in 9 women will be affected with breast cancer in the UK. Around 45,000 women were diagnosed with breast cancer in 2007. The incidence of breast cancer increases as you get older. And unfortunately, some women do present with something called metastatic breast cancer, and that's breast cancer that's spread to other parts of the body. That only happens in 5% of women that present with breast cancer. Unfortunately, even women that have localised breast cancer and have it treated, in 30% of those women, the breast cancer can return and found to be spread around the body. So women that have a history of breast cancer, even after treatment, need to constantly re-examine their breasts for new lumps. The treatment that is given to women with breast cancer very much depends on the size of the tumour at diagnosis. It also depends on the stage of the cancer, how far has it spread, is it in just the local tissue or has it spread to other parts of the body. It also depends on whether the tumour is hormone sensitive, which means it reacts to hormones in your body, and it also depends on the woman's age. However, I will say that breast cancer has a very good survival rate. After 5 years, 80% of women have fought and are breast cancer free. A special mention about breast screening: all women between the ages of 50 and 70 years old are invited for breast screening. They undergo a special X-ray called mammogram, which picks up very small breast lumps, and it picks up lumps so early that you're unable to feel these lumps. And so women from the age of 50 to 70 every 3 years will be invited for this screening, and fortunately a lot of very early breast cancer is picked up and treated quite simply through a screening process. So if you're between 50 and 70 years old, do not neglect your breast screening. Once you get that letter through, make sure you keep up to date with this. So to summarise, breast symptoms are very common in all women of all ages. If you find a new lump, do speak to your GP and get that checked. However, the vast majority of breast problems are not due to cancer and can be easily managed, easily diagnosed, and often don't require any treatment. Finding a breast lump is not an emergency, but don't sit on it for too long. And I think the most important thing I will say here is all women should be in the habit of examining their breasts every few weeks, maybe every month, because you need to know what is normal for you so you can pick up any changes when they happen. Thank you for listening today on our topic of breast health. I hope that's been helpful to you, and inshallah we'll chat soon about another topic. Assalamu alaikum.